Welcome to our introduction on MR of neuroanatomy. I'm going to start out with a very basic approach to neuroanatomy with a sagittal, flare, three-dimensional 1 millimeter image in the midline showing you the brain stem, the medulla with the medullary clava, the medullopontine sulcus, the pons, the midbrain, and you see the mammillary body is a nice little landmark anterior to it. There's the pituitary gland and fossa. And we're going to drill into each one of these subjects separately. We've got the collicular plate, the inferior colliculus, and the superior colliculus. Behind that is the cerebellum with the lobes of the vermis lying below the tentorium cerebelli, and there's the straight sinus and vein of Galen. Now just above that, if we scroll a little bit, we've got the occipital lobe, responsible for vision with the calcarine sulcus. Separating the occipital lobe from the rest of the brain, including the cuneus and the precuneus, is the parieto-occipital sulcus. So this is the boundary between the occipital lobe and the parietal lobe. Now let's go out a little bit to the side for some just very gross anatomy, looking at the frontal operculum and the temporal operculum and the Sylvian fissure, which is shaped a little bit like a caterpillar, and it separates the frontal lobe from the temporal lobe. Now there are some very specific areas of anatomy that we'll talk about, including Broca's area, in a separate vignette in the anterior frontal lobe. The separation of the frontal lobe from the parietal lobe falls to the central sulcus of Rolando. So here's the precentral sulcus. I'm going to show you in a few more vignettes how to identify it. There is the central sulcus. Here's the precentral gyrus, which is bigger than the postcentral gyrus. So the central sulcus, now we follow it off to the midline. There it is. There it is. It's a little hard to see in the midline. It has more of an oblique configuration to it, so we kind of lost it a little bit. It's right there, actually. That will separate the frontal lobe from the parietal lobe. You can see there's a lot less parietal lobe right here than there is off to the side. If we go back off to the side, there's a lot more parietal lobe. Let's go back to the central sulcus of Rolando. It's right there. So this would be frontal, this would be parietal, this would be occipital, and this would be temporal. Now, one other thing you should be aware of is that these sulci, they don't go straight up and down. They're oblique. So depending upon where you are from top to bottom or how you angle, if you angle this way, things are going to look different than if you angle like a CT this way. And we'll talk about those differentiators and how to identify specific anatomy based on those varied angulations in a separate vignette. So I've given you a rough idea of the brainstem, the cerebellum, the occipital lobe, the parietal lobe, the temporal lobe, and the frontal lobe, and given you the means to distinguish their locales. Let's move on, shall we?